So I've been a travel physical therapist for 2 years now, and it's been a great time. I have a great work-life balance, I make more money than I did before, and overall, my quality of life is just so much better. I'll always recommend that anyone that can travel at least tries it out. But I'm not going to sit here and say that everything's perfect. With all the freedom and the opportunity you have with Travel PT, there's always going to be some not so fun things that come with the job. Since I've been doing this job for a while, I feel like I've experienced a good bit of both, the good and the bad. So I wanted to make this video about some of the pros and cons that I've experienced personally when it comes to travel physical therapy. Pro number 1, higher pay. Usually whenever the topic of travel therapy comes up, the first positive that comes up is the fact that you're usually compensated at a higher rate. It was one of the main reasons I made the switch. Times were hard for a lot of people a couple of years ago, and it seems like they're only getting worse. One of the main complaints I hear from some of the other therapists that I work with is we're just not compensated at a rate that's fair for what we do. A lot of us took out a lot of student loans and went into debt to be able to go to school, and the return on investment in a lot of cases just isn't worth it. With Travel PT, I have a base salary with tax-free stipends for housing, food, and incidentals that are added together, and I get paid that weekly. And let me tell you something, the first time I made what I made weekly, what I used to make bi-weekly, it just does something to you. Financial security is so important, and with travel therapy, I have that security. Number 2, flexibility and travel opportunities. One thing that drove me crazy as a staff PT was having to ask permission to take time off. Now, PTO and the amount that you're promised is an important part of any job, but I remember mine just built up and accrued so slowly, and having to jump through hoops and explain why I needed time off when it was my damn time off to take. Now, you don't get PTO with travel physical therapy, which might be a con to some, but with the money that I'm able to make, I can take up as much time as I want comfortably on my own time. Also, have you ever been stuck in one city or state for years and just thought about being someplace new? Maybe you've been doing outpatient ortho for years and wanted to get back into sniffs or try home health. You have the option for Travel PT. In some cases, you can even go into settings like inpatient and working in school systems. I know what it's like to feel like you're stuck in one place and you just want to explore something new, even if it's just temporary. For example, DC is my favorite city, and I've always wanted to live close at least for a little while just to see how I would like it. And I did. One of the first contracts I did was in Maryland, and it was great. Expensive as hell, but great. I was able to do that with travel physical therapy. That leads to my third pro, my Travel PT. Another common theme with the conversations that I have with therapists I work with is the feeling of being burnt out with patient care. But it makes a lot of sense. As healthcare professionals, we give so much to our patients. We stress and worry about their ailments, their problems, how best to help and serve them, and that can be a lot day in and day out, especially mixed with being in a not so good clinic environment. And you know the kinds I'm talking about. Seeing too many patients on the hour. Maybe you have an overbearing or micromanaging boss, not getting along with your coworkers. That's so much to deal with, and it can really speed run that feeling of burning out. Now, I genuinely enjoy what I do, but I want to make sure that I can at least do it on my own time. And things are always a little bit better with the timeline. One thing I always say, if I don't like wherever I'm working, I can do anything for 3 months. Now let's go to some of the maybe not so great things about what I do as a travel PT. Number 1, moving around constantly and having to adapt. This caught me a little off guard at first. Maybe it's because I'm a bit of a procrastinator, but moving every 3 to 6 months can be a lot, especially depending on where you're moving. Adjusting to a new city can be scary and lonely. Going into a new clinic, learning their documentation system, where they keep their equipment, running a whole new caseload, it's always a little jarring at first. Plus, if you're getting that stipend money for your housing, you're responsible for finding your own housing. And I usually take contracts in more urban populated areas, so I don't have too much trouble finding where I'm going to stay at. But if you're moving to a place that's a little more out of the way, a little bit more rural, you may have a little bit more trouble. Number 2, job instability. Another thing that really surprised me was that sometimes you're not guaranteed to finish out your whole contract. It's up to the clinic you're working for. If you're not hitting productivity, maybe they hire a full-time therapist or the caseload just isn't big enough to justify keeping you around, then it's really up to the discretion of the clinic whether or not they want to cancel your contract if they so see fit. And obviously this can be extremely inconvenient at best due to, signing a lease and just planning on being in one area for an extended amount of time. Now, this only happened to me once so far. I originally signed an extension at the clinic I was working in, but it turned out that they didn't really need me after all, so they canceled it. And obviously this was a little jarring, depending on how much time they give you between informing you of their decision and what they decide your last day is going to be. That's why being flexible is so important as a travel physical therapist. Navigating licensure and taxes. Obviously you have to be licensed to work in every state you take a contract in. Some states are a breeze, and some have a couple of additional steps for their licensure. But the good thing is, for most if not all these companies, I'm sure that licensing costs are reimbursable. At least it is for my company. Now, I'm no tax expert or accountant, so I'm not going to get too specific with all of these requirements because I don't want to give any wrong information accidentally. I recommend at least talking to a professional, but as a traveler, you do have to establish a tax home, which is your primary place of residence where you maintain business, and also maintain that tax home according to IRS guidelines. I put this as a con because when I first jumped into travel therapy, I thought you just moved, worked, and made money. But due to the nature of what we do, the income is different, so you have to make sure that you're not setting yourself up for a bad financial mistake. So you can understand how this can lead to a bit of a learning curve. It's not terribly complicated to understand, but it is important to know. Now, at the end of the day, traveling has some great perks, but it's not for everyone. In my opinion, the goods so much outweigh the bads. And the cons aren't too bad themselves. If you're able to be flexible, want to make a little bit more money in your practice, and just always want to travel, I say go for it. There's usually nothing holding you back but yourself. If you travel and have anything else that you want to add, any things that you like or don't like about the job, let me know in the comments. Thank you for watching.